It's Patrick from Intensive Care at Home, where we help long-term ventilated adults and children with tracheostomy and their families to improve their quality of life and also help hospitals saving money and resources whilst providing quality care. In this week's update, I want to quickly talk about how to improve a niche within intensive care. Have you ever thought what it would be like to offer a long-term ventilated patient in intensive care to go home? What would the patients and their families' response be? How would they feel if after many weeks in intensive care they could finally go home? The patient and their family would be absolutely delighted, and once at home their quality of life is going to improve big time, rather than spending many more weeks in intensive care. The patients and their families can decide how to organize their days away from the pressures and the schedules of an intensive care environment, without having to compromise their safety and their well-being. Intensive Care at Home's critical care registered nurses will look after the patients and their families in all key areas of independent living around the clock 24/7. How much nicer would this alternative be for the patients and their families? Our services are specifically tailored to give patients and their families valuable and precious time that they can spend together in their own home rather than in an intensive care environment. Improving the lives of long-term ventilated adults and children with tracheostomy and their families requires specialized critical care nursing skills, clinical experience, and, more importantly, a different approach and a different mindset from conventional clinical intensive care nursing, as our services are focused and tailored towards opening windows of possibilities, opportunities, and an approach of what we believe is in the best interest for patients, their families, and also for hospitals and intensive care units in particular. The demand on ICU beds remains consistently high, and rather than keeping long-term ventilated adults and children in intensive care, you could start sending your long-term ventilated patients home and let them experience a better quality of life or quality of end of life, and everybody wins. What are your thoughts on this topic? Leave your comments on our blog. If you are a health professional in intensive care and you think you know a long-term ventilated adult or child with tracheostomy and their family who would like to improve their quality of life and/or their quality of end of life in their own home rather than in intensive care, even if it's to go home for a couple of days, and if your organization would also like to save some money and resources along the way, or if you simply have any questions, send me an email or give us a call, and I'll see you with another update in next week. Thank you.